Welcome to What's Trending, your go-to podcast for staying informed about what's trending in the ever-evolving landscape of Westchester and beyond. We are your hosts, Amanda DePalma, Senior Vice President of Events and Development, and Dr. Marci Gordon, President and CEO of the Business Council of Westchester. On today's episode, we're diving into the intersection of sports medicine and wellness, from injury prevention and HSS's growing presence in Westchester to the BCW's upcoming HSS Day of Wellness. Joining us is a true expert in the field, Dr. Marci Goolsby, Medical Director of the Women's Sports Medicine Center and Director of Patient Care and Quality of the Primary Sports Medicine Service. What's Trending is sponsored by Thompson & Bender. Thank you for the support of the BCW Podcast Network. Looking for unparalleled success in PR and marketing? Look no further than Thompson & Bender, the leader in strategic communications. With over 30 years of expertise, they've mastered everything from PR and advertising to social media and event marketing, ensuring their clients' success. Recognized with awards like the Business Council of Westchester Hall of Fame, City and State Power 100, and voted Best in Westchester for advertising, public relations, and social media by 914 Inc., their track record speaks for itself. Join the ranks of clients from Fortune 500 corporations, small businesses, educational and healthcare institutions, and many more who've benefited from their innovative strategies. Trust Thompson & Bender to elevate your brand to new heights. Welcome, Dr. Goolsby. Thank you so much for being here.
Yeah, thank you for having me.
Absolutely. Before we really dive into the particulars of HSS and this wonderful day of wellness that we partner on, tell us a little bit about yourself.
I'm a primary care sports medicine physician, so trained in family medicine and sports medicine. I did my training at UCLA, and I've been at HSS since then. I have the honor of being the medical director alongside my co-director in orthopedics for the Women's Sports Medicine Center for the last few years. And and just love seeing patients every day, kind of in my regular day-to-day practice, see almost everything.
Tremendous. I wish you were around when I dislocated my elbow back in like the 8th grade. You probably would have been fantastic.
That hurts.
It does, but we recovered. So HSS has really grown significantly in recent years. What can existing and future patients across the region expect from this expansion?
Yeah, we're in a really exciting time. We're constantly looking at and positioning ourselves in a good place for the future, trying to anticipate what's coming in the world of healthcare and particularly in our areas, particularly growing our regional sites, including our Westchester practice. And we have a lot of new places opening up in Connecticut as well. We just opened our new facility in northern New Jersey in Paramus, which is beautiful, I've been told, and really looking at expanding what we can do for the patient beyond kind of beyond addressing the injury as they come in with, but trying to anticipate it, working on prevention work. So we've really put a lot of thought into our performance and wellness aspects as well.
And I think that's so important. I mean, we see so much in the healthcare industry how it's a reactive industry, and it's just so good to hear the preventative side of it. For HSS Westchester, and that's the Hospital for Special Surgery Westchester, for those that aren't familiar with the 3 letters, where is that facility located, and how does it really serve that local community?
So HSS opened HSS Westchester about 8 years ago with the goal of bringing world-class care closer to home for the patients who live in the greater Westchester area. And I think it was particularly great when we opened pre-pandemic, because in the pandemic, we saw a lot of our patients moving out of the city. So it was great that we had this facility here. We're located at 1133 Westchester Avenue in White Plains. Tons of parking, easy on and off 287. And we have a lot of different physicians that see patients out of here. So kind of full spectrum orthopedic, rheumatologic, rehabilitation care for the residents in the area. Basically having the same services for the most part as the experience in our Westchester offices on our Manhattan campus. So having that world-class team treating the full spectrum of musculoskeletal conditions, and radiology and imaging services are available here as well.
So really just the full spectrum of everything HSS has to offer. That's
Yeah.
great.
Yeah.
Can you walk us through some of the new services that HSS Westchester has introduced over the past year, and maybe some of the new services that some of the other locations you had mentioned that were also,
Yeah, so we're constantly expanding, what services we provide at our regional sites. One of the biggest initiatives that we've been working on with the hospital is HSS Orthopedics Now. So that's our newest service. We have it in Westchester, as well as some of our other regional sites, and it's providing access to general orthopedic care for acute injuries and acute pain for patients 12 and over. We're open 7 a.m. to 7 p.m. Monday through Friday and have some Saturday availability as well. So it's just trying to improve the access for our communities. And so during that appointment, one of our experienced HSS physician assistants or nurse practitioners evaluate the symptoms using X-ray imaging when necessary, helping come up with a diagnosis and treatment plan, and then if needed, coordinating care to follow up with one of our physicians and determining kind of next steps if they need help navigating that process. We do require appointments, so it's not a walk-in, but most are available same day or the next day, and they can be booked online or by calling our general number.
Super convenient. Now, I don't know about you, but my social media was flooded this weekend with nothing but Masters content.
It was exciting to watch
It
as
was
well.
very exciting. Exactly. All I want now is a pimento cheese sandwich and an azalea, and I don't even know why, but evidently the world of social media has told me I want that. So this conversation is incredibly timely. For sports medicine, what exactly is sports medicine?
Yeah, so obviously it's implies that we take care of people actively involved in sports, but it really extends beyond that. It's kind of taking care of all active and athletic individuals. And I do have some people come in and say, I'm not sure that like I fit into sports medicine, but I'm like, are you walking your dog every day? Yeah, well, that's active medicine. Like that absolutely is sports medicine. We're trying to get people to either improve or be able to continue the activities that they're doing. So it doesn't mean that they have to be, a professional athlete. Of course, we take care of those people, but that's not mostly who we take care of. We take care of people who are just trying to improve their symptoms and be able to stay as active as possible. And that's our goal as providers as well, is getting our patients back to what they enjoy doing, hopefully with less pain.
And I think that's such an important differentiation because, when you say sports medicine, you're right. I think everyone's instinct is to just think, I need to be an athlete to do it. But when it really refers to someone who's an active individual, and obviously right now, more and more people are focusing on their own wellness and their own activity. But that doesn't mean that they're, not that doesn't mean that they won't become injured, as you said, walking your dog, someone going running, someone who's an avid tennis player, even if they don't play competitively, they're still active. And so, I think it's important that people do know that if you're going to be active and at this level of wellness, this is something that could be beneficial to you and apply to you. What trends have recently developed in the world of sports medicine? What advancements, what are you really seeing in the space?
Yeah, I mean, I think the two of the areas that come to mind that we're constantly challenged by are tendon issues. So tendinitis, for example, rotator cuff, Achilles tendinitis, that's always a developing area. And the second being cartilage and arthritis related symptoms. So I'd say some of the new trends that we're seeing for tendinitis issues and some other issues as well is using shockwave. So we recently just acquired a shockwave machine here in Westchester for our providers to use, which I'm excited about. So plantar fasciitis, Achilles tendinitis, patellar tendinitis, but even other musculoskeletal issues like muscle strains, overuse, that kind of thing, shin splints. So I'm excited to sort of work on that a little bit more. It's not a brand new modality by any means, but it's definitely catching on. It's something that a lot more providers are using. Similar to that is things like PRP, so platelet-rich plasma. That's where it basically takes your blood and injects it back into a joint or a tendon. So that's another thing that is definitely not new, but is certainly something that's being used a little bit more broadly in sports medicine. and arthritis as well. And then in the cartilage and arthritis world, not being one of the surgeons, they can speak more to the cartilage procedures that are certainly there's more and more being developed. If somebody has, the way I describe it to a patient is like a chunk of cartilage missing or a hole or a ding, as opposed to more global cartilage loss, which is what our osteoarthritis is. So on both sides of that, things like cartilage procedures where they're trying to sort of plug that hole using a variety of different techniques. And then in osteoarthritis, different injectable options. There's a lot of ongoing research at HSS and regenerative medicine trying to look at some of those things like PRP and other things that can be injected into the joint in patients with arthritis to just add to our toolbox, add to the tools in our toolbox outside of just replacing the knee. Which is still obviously something that can be very valuable and patients sometimes end up having to do, but just making sure that we have as many options as possible for people.
Now, are you seeing, and just sort of a continuation on this, under being the director of the Women's Sports Medicine Center, are you seeing anything that's more specific to active women than active men that, listeners on either side should be, paying more attention to?
I mean, certainly in terms of the relation to the gender, ACL injuries is still a significant epidemic. We see 5 to 10 times more likely to have an ACL injury as a woman. You've seen a couple recent high-profile cases in the WNBA and in college sports, which can be incredibly devastating for those athletes and for their teams. And so always looking at injury prevention. But then if somebody has had an ACL tear, whether it's gets surgery or not, the process of arthritis begins. And so dealing with that post-traumatic arthritis, as we describe it, is something that we really need to have more research into and something that we're always looking at. One of the things that I do clinically as well is I see a lot of bone stress injuries. So that encompasses stress fractures, stress reactions, which are where there's inflammation in the bone but not yet formed a crack. I do a lot of that work in my practice. That's a big part of what I do. And looking at things like shockwave for stress injury healing is something that we're about to start a big research project on. So trying to look at other ways to get people back to being active, whether it's a post-traumatic arthritis from an ACL injury that happened years ago, or whether it's a current stress injury to the bone. Those are a couple things.
Well, thank you for that. I think especially going into now the spring and the summer months where, individuals are going to be outside, they're going to be even more active. I think these are just all important notes to keep in mind. And then coming up, obviously, with the Day of Wellness on May 19th at Scarsdale Golf Club. HSS has been such a tremendous partner in growing this event. Can you share a little bit about why partnering on this event is so important to HSS and your initiatives?
As the world's leading academic medical center focused on musculoskeletal health, HSS recognizes the importance of healthy competition, daily activity, relaxation, recovery. That's important both for our physical and our mental well-being. So we see the Day of Wellness as an ideal vehicle to help celebrate the importance of healthy exercise, staying active, getting active, self-care. So this event allows HSS Westchester specifically to be present, connect with our local business community, fostering relationships focused on keeping our patients happy, healthy, and doing what they enjoy doing what they love to do.
And we so appreciate that. What advice do you have for the listeners and for the folks that I know that are going to run to register for the Day of Wellness as soon as they hear this podcast? What can we tell them to help them stay injury-free, both by participating in the event or getting ready for it? What can you share?
Well, start. So, sometimes coming into the spring, people go 0 to 60 a bit too fast. So I think if you're going to be golfing or playing tennis before that day, trying to get out there and hit a few balls would be helpful to kind of get the motion back if you haven't been doing it for a while. It's doing things like a good strengthening program, a good flexibility and mobility program is really helpful. Now, we don't have a ton of time between now and then, so I'm not sure a robust strengthening program is something that's going to make a big difference between now and then. But certainly long term, that can be incredibly helpful for injury prevention. In terms of mobility and like warming up, kind of preventing injuries and just feeling better that day, for both sports, it's very much a rotational sport. So working on what we call thoracic mobility. So thoracic spine's our mid-spine, and just trying to stay loose. So doing things like cat-cows and rotational work, what we call open books, to sort of work on that. And you can do that the day of to sort of warm up as well. So you see golfers out there with like their, golf club kind of rotating back and forth, but doing a lot of that work, warming up ahead of time. Both tennis players and golfers can get really tight in the front of their shoulders as well. So doing stretches to open up the chest and the door jamb, especially because we're countering our lives, which are here in the computer. So the shoulders being rounded forward. So really trying to counteract that to get things moving through your mid back and opening the chest can be helpful. And then that day, just warming up well, so you're not getting out there, because sometimes we get a little competitive.
Just a little.
When we
just
get
a
onto
little.
the court or get onto the course. So just making sure you have a good warm up and taking it easy and staying loose is really valuable.
And most importantly, there will be a number of HSS representatives there on site. So if someone doesn't listen and do what you tell them to do, there'll be plenty of people to help. So I will go and begin my robust training program right now as soon as we're done here. So
work on those cat-cows and open books and door jam stretches.
We'll work it into the day.
Yeah, that's right. In sports medicine, we always have this saying, like, we want to be there and be prepared, but never be needed. So hopefully that would be the case on the day of wellness.
Well, we so appreciate that. Thank you so much for joining us today on What's Trending, Dr. Goolsby. This has been an incredibly insightful conversation. Thank you again to our sponsor, Thompson & Bender, and our listeners. Please join us on Monday, May 19th for the BCW's HSS Day of Wellness at Scarsdale Golf Club. It really will be truly a special day dedicated to relaxation, mindfulness, movement, and workplace well-being. We hope to see you there. Thank you again, and thank you to HSS.
Thank you. Thanks for having me.
Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, What's Trending, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more, go to thebcw.org.